One of the techniques we use in the office a lot of times, we've got a pretty, let's say, mild to moderate disc flare up in the cervical spine, is teaching patients how they can do some self-tractioning techniques. Now there's a lot of expensive apparatuses you can buy for floor traction care, like the Saunders device. We have some of those that we lend out at the office for more long-term solution. But on the short term, you can buy some things that attach to the door frame or the doorknob that you can find on social media and Amazon and things like that. But believe it or not, this is probably one of the most simple, inexpensive fixes. It's just that you have to have something that you can attach it to. This is obviously our bigger monster band. There's a blue one that works just as effectively if you have maybe it's a smaller individual, shorter, things like that. But most of the time we like to use this thicker one. It's about 2 inches in diameter because it cradles the head a little bit better. So you want it about 45 degrees to the actual cervical spine. So that's about, so if you know what height you got to set it at. Sometimes you can also wrap this around the doorknob. That will work as well, unless it's way up here. So try to find something, if you walk up to it, and see exactly how far it needs to be. So it doesn't need to be down like this pulling. You can do it that way, but you're probably only going to feel it right up underneath the actual occiput or the skull itself. So we'll really only get like the C1 and C2. But if we get it up closer to like 45 degrees, and we get in this angle, it'll actually lift up more to that C5, C6, C6, C7 region where most of our disc issues happen because we have all of the flexion and extension of the spine right there. So what we'll do is just come down, and you can do it yourself. What you're gonna do is just find that area just in the upper cervical region, just below the ears. Get comfortable with it. And the intentions for this are to not basically have so much pressure in the pulling that it lifts the head way up, but just enough to where it basically comes off the ground and can almost, it's about maybe the back of her head is about an inch or inch and a half off the ground, and she's just going to relax and it's just going to pull at that angle. And where do you feel it right now?
Right at about my C6.
Yeah, so just above where the traps come up into the actual neck, where obviously they come all the way to the back of the skull, but where you feel where the neck meets the actual shoulders. And you're going to hold this for about a minute, minute and a half. Again, with most traction in the neck, you don't want to really pull any more than like 20 to 25 pounds. If you do too much for too long, it can fatigue the muscles. But when you go to stand up or sit up, you'll feel a lot of sometimes a very unstable feeling because those muscles have gotten so fatigued. We don't want to do that. So again, you hold it for a minute, minute and a half, and then by yourself, you can grab a hold of it. She's just going to take some tension off of it, take her head out of it. Sit for about 30 seconds, let all those muscles recoil back, and then she's going to go through another cycle of a minute to minute and a half. You'll do this for about 10 cycles. Do it in the morning or afternoon as you're going through an aggravation, especially if you're trying to actually increase the pliability in that disc and try to get a little bit more water in it and just kind of decompress it a little bit.